getting ready.
So I'm a big believer in working together with other organizations that help people with diabetes in some way. And what I want to make about this slide is, most of the healthcare dollar goes to end-stage complications. And if we just put more money into prevention, education, getting folks that need the medications and devices they need early, we would spend a lot less money down the line. So the bottom line is diabetes is not a rare disease and it's not an inexpensive one. And I fight insurance companies all the time. I talk to these healthcare executives who are trying to save money and make a profit. And I'm begging them to help open up their. And at that time, insulin was being talked about. So she was born in 1912 and she died in 1919. Very sad. Now, Ted Ryder is one of the most famous kids ever to get insulin, one of the first kids. He's 5 years old, it's 1923. He's scrawny, he's sickly looking, he's not very happy. And if I had to wear that goofy outfit, I don't think I'd be that happy. Here he is, 5 months after starting insulin, and Ted Ryder lived to the age of 75 years of age. And Chris Freeman, you can see he's wearing his CGM sensor on his skin, and unfortunately he was taken out of competition in the Olympics because he got low and got delirious and turned the wrong way. I don't think that'll happen to him again.
White bread more likely than whole wheat bread to spike up our sugar? Yes, so that would mean white bread is high on the glycemic index. What about
diabetes being one of our areas that we
You learn so much from just interacting with others around you, hanging out at lunch, talking about where you wear your infusion sets, which CGM you use or don't use. There's a lot of power in that.
It's tough. But for me, when I wake up high, it's typically because I had a late dinner and throughout the night, my little Dexcom's going off and I'm giving myself small boluses because I don't want to get low. And I just seem to underdose myself for fear of hypoglycemia. And then when I finally do the rage bolus, then I bottom out. But I
Kidney's abilities to do that. So you purposely pee out some sugar. So since you're peeing out some of that sugar, your blood sugars don't go so high. And with that sugar, actually you're spilling calories, so people tend to lose a little bit of weight. The good thing about this mechanism of action is it has nothing to do with the pancreas, nothing to do with insulin production. So there's no reason why it actually does work very well in type 1 diabetes. And it's a once-a-day pill. So they're working on getting this approved in type 1s, and if so, it would be the first pill for the disease. So tell us your experience.
I just say, I got asked a question, is it bad for your kidneys? Because this person thought sugar in the urine was bad. So it does not hurt the kidneys as far as we know. They've had studies now up to 3 years. And I don't think the FDA would ever approve a drug that causes kidney problems. But it is a different paradigm. You're purposely pushing out sugar in the urine, which explains the main side effect is a slightly higher rate, 10 to 15% higher rate of yeast infections in females, and about a 5 to 6% higher rate of yeast infections in men, and those are primarily uncircumcised men. So, Randy, tell us how Invokana has helped you. Not if you're circumcised or not.
It just, as soon as I started taking it, it just seemed like it really knocked the highs and the lows in my readings, smoothed things out a lot. I really got thirsty for like the first week or so on it, and then everything mellowed out. I don't seem to have the thirst that it caused for me anyways then, but it was night and day difference for me.
Yeah. And that's the experience that I've heard from a lot of patients, that your insulin requirements go down overnight, and it kind of just makes things a little bit easier. You know, if you were supposed to take 6 units for a sandwich, and you only did 4, this med can kind of pick up the slack and help you, instead of going to 300 if you miss dose, maybe only to like 200. So it's a really interesting class of medications. I do think this will get approved for type 1s. So I would say, have that conversation with your healthcare provider. If you're the type of person that likes to jump on things right when they come out, and you're an early adapter, and go for it.
I'm not good at counting carbs. I always underestimate, what I need. So I know some of you are extremely good And I'm not against carb counting at all, and I think to me, when a diabetic sits down to figure out how much insulin, they could look at the carbs, they could look at past experience, they could look at the amount, and then kind of get the best guesstimate of how much you think you would need. So, Carrie, Lauren, you guys you carb count?
So again, both federal law and state law define diabetes as a disability. Their stomachs, for example, they don't want to pull out their shirts in the bathroom where other employees are or something like that. So if requested, they're entitled to have a private area to test. Attendance policies. If you end up, with really, hypoglycemic early in the morning and you come to work late, if the employer has a rigid policy about attendance, if you're not on time 3 times, we fire you. If you're a diabetic and you fall under California or federal law, they have to provide an accommodation for you. And if you're late a few times because of that, things along the production line. And if I have to take a break and the production line comes to a stop, that's a problem for the employer. It's a huge problem. But the law requires the employer and the employee to get together and try and figure out a way to accommodate the employee's disability by an interactive process, a good faith interactive process, meaning we talk to each other back and forth and see if we can come up with a solution. And that solution has to be one that I talked about in the beginning, which is to allow the employee to succeed in their job, right?
Because a lot of hesitation for Twitter is you're sharing personal anecdotes about your life. That's kind of the hesitation with the internet in general, right? Why are you doing this? Why are you sharing this? So why would you bother tweeting that you forgot glucose tabs and you felt like a crumb about it? What do you get out of sharing it?
Because other people might be in the same boat and just not know it, and that instantaneous connection really kind of improves self-confidence and self-control when it comes to managing type 1, which is really all what we strive for in this room, hopefully.
Cure, bionic pancreas coming. There's just so much excitement in this space. So I don't want to give away Ed's story completely because I think he's going to tell all about it. But Dr. Damiano from Boston, you guys I'm sure have heard all about him. We're thrilled to have him come talk to us about all his research and all his progress with the bionic pancreas, which will be a huge step forward and something that's very tangible on the horizon.